Good morning, sir.
Yeah. Big heading radiology.
Good morning.
Yes, it's good. Radiology. Radiology. Yeah, right on the topics. First one, diagnostic radiology. Diagnostic radiology. Second one, diagnostic ultrasound. Diagnostic radiology. Diagnostic ultrasound. Next one, radiological guidance. Radiological guidance. Next one, obstetrics. Obstetrics. Next one, mammography. 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 Next one, brachytherapy. 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 Next one, bone or joint studies. Bone or joint studies. Bone or joint studies. Next one, nuclear medicine. Nuclear medicine. Nuclear medicine. And last one, radiation oncology. radiation oncology. Total, how many topics are there in radiology? Total, how many topics I say?
9, sir.
9. Again, I am repeating: diagnostic radiology, diagnostic ultrasound, mammography, radiation oncology, nuclear medicine, radiological guidance, brachytherapy, bone or joint studies, like this. Okay. Yeah. First, make heading: mammography. Mammography. Go for radiology chapter. Radiology chapter. So this chapter is mostly based on the key terms that we need to memorize, the key terms that I will give you in the form of flowcharts for you all. Radiology, what's the page number? 514. Are you there, everyone? Page number 514.
Yes, sir.
Okay. You can see the concept in radiology. First topic, you can see diagnostic radiology. Diagnostic radiology.
Yes.
That is the first concept. Like that, we need to go for mammography. We need to go for mammography.
Page number 543, sir.
Page number 543. Are you there, everyone? No. See the difference between screening, diagnostic, and therapeutic. Everyone knows the difference between screening, diagnostic, and therapeutic. Just note down first point. Screening. Screening means no reason for visit. Screening means no reason for visit. No reason for visit. Came for annual or wellness examination. No reason for visit. Came for annual or wellness examination. Annual or wellness examination. Next point. Diagnostic. Reason for visit. A reason for visit to find out the abnormality. A reason for visit to find out an abnormality. Reason for visit to find out an abnormality. Reason for visit to find out an abnormality. Next point. Therapeutic. Therapeutic means providing treatment. Therapeutic means providing treatment. Now you can see screening means, is there any problem the patient is having when she or he is in the hospital?
No, sir.
No, sir, without symptoms.
Coming for general routine checkups. If she is having a problem and coming for checkups, can we call it as diagnostic?
Yes.
Okay. If to a problem treatment is provided by the physician, can we call it as therapeutic?
Yes.
Okay. Now, when mammo means what? Mammo means
Breast.
breast. Okay. Now,
Breast.
when you got this concept mammography in the question, see what you need to do. Just note down that flow chart. First, we just take like it as mammography. Mammography. See the screen. Mammography. Mammography. First one. Screening. Screening mammogram. Next. Diagnostic. Diagnostic. That means in the question, when you are getting mammogram, what we need to look for? Screening mammogram. Diagnostic. Diagnostic. Third one, MRI. MRI. Fourth one, tomosynthesis. 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 Now, when you are getting a question regarding mammogram, what are the key terms we need to look for in the question? What are the key terms?
Screening, diagnostic,
Screening
diagnostic, MRI,
or
tomosynthesis.
diagnostic mammogram or MRI or tomosynthesis. These are the four key terms we need to look for. If it is a screening mammogram, then the code is bilateral. Bilateral. Just put arrow down like this. Bilateral. If it is diagnostic mammogram, it may be unilateral, bilateral. If it is diagnostic mammogram, it may be unilateral or bilateral. It may be unilateral or bilateral. Next, MRI. Again, it may be unilateral or bilateral. MRI, it may be unilateral or bilateral. Again, tomosynthesis. It may be unilateral or bilateral. Now, mammogram. You are getting a question regarding mammogram. What are the key terms we need to look for in the question now? What are the key terms we need to look in the question?
Screening, diagnostic. If it is coming for screening, we need to check bilateral. Diagnostic
Screening.
means we have to check unilateral or bilateral.
Bilateral. If it is MRI means unilateral or bilateral. Tomosynthesis means unilateral or bilateral. Now you can see the codes in your book. If you understand the key terms, the radiology is very easy for you. Can you see the code 77061? 77061. The key term tomosynthesis is there. 77061. Yes,
Yes,
sir.
sir.
The technique name they may document. That's what I am saying. See, without techniques, we can't find out as a coder. The technique name clearly they will document. Tomosynthesis is performed on breast. Immediately you need to look for on one side, are they performed on both sides, unilateral or bilateral. 061, 062. Can you see the code description 77067? 77067. See the code description 77067.
Screening
Screening
mammography bilateral.
bilateral by default. See, without reason for visit, that means if she is coming for annual examination, by default they performed on both sides. If she is coming with a problem, you can say it's a diagnostic, then we can say if she is having on left side, they will perform unilateral. If she is having on both sides, they will perform bilateral. See the code 770651066. 0651066. Yes sir, no, the codes are belongs to diagnostic mammogram or not?
Yes, sir.
Now you can see MRI 77048. 77048. Again it is unilateral or bilateral. Vishnu. Vishnu.
Yes, sir.
Yeah, Vishnu. You are getting question regarding mammogram. Mammogram in the exam.
Okay, sir.
What are the key terms you need to recall when you are reading a question?
Yes, I have to recall screening. Screening whether it is bilateral, and diagnostic whether it is unilateral, bilateral, and MRI whether it is unilateral, bilateral, and tomosynthesis whether it is unilateral, bilateral.
So first you need to recall the 4 key terms. Once you got a key term as screening,
Yes.
then it's bilateral like that. Understood now everyone how to code mammogram? Next one, make heading bone or joint studies. Bone or joint studies. Bone or joint studies. Bone or joint studies. Now can you recall that? See, I said axial skeletal when we are discussing musculoskeletal system, axial skeletal and appendicular skeletal.
Yes, sir.
What are the
Sir.
parts comes under axial skeletal?
Head, neck,
The neck trunk.
trunk,
What are the parts comes under appendicular skeletal?
upper extremities,
Extremities.
lower extremities.
Okay. Now, DEXA scan. You just make heading DEXA scan. DXA. DEXA scan. First try to take the flow chart, then I will explain the concept for you. DEXA scan. Just again take the flow chart. Where it is performed. Axial skeletal. You just note down. Axial skeletal. Axial. Second point. Appendicular. APP. ENDICULAR. Appendicular. Third one. Axial with vertebral fracture assessment. Yes, you can note down. Third point. Axial with vertebral fracture assessment. Axial with vertebral fracture assessment. Fourth one. Only vertebral fracture assessment. Only vertebral fracture assessment. only vertebral fracture assessment. What are the 4 key terms for DEXA scan? First one is axial skeletal. Second one is appendicular skeletal. Third one is axial with vertebral fracture. Fourth one is only vertebral fracture. Now write down. DEXA means dual. DEXA means dual energy X-ray absorptiometry. DEXA means dual energy X-ray absorptiometry. It is used to study bone strength. It is used to study bone strength and mineral density. Bone strength and mineral density. It is used to study bone strength and mineral density. It is used to study bone strength and mineral density. Now you can see the quotes. Can you see the code 77080, page number 545? 77080. Double 77080. Sir. 77080.
Sir, we are there.
Okay. You can see the code description there. Axial skeletal, more than one side, but the parts are from axial skeletal. 77081, appendicular skeletal. 77085, axial skeletal with vertebral fracture. 77086, only vertebral fracture assessment. DEXA scan, when you are getting a question regarding DEXA scan, they are performing on axial skeletal parts, appendicular skeletal parts. Axial with vertebral fracture or vertebral fracture. Why they will perform DEXA scan? Bone density. To find out the strongness of the bone. Understood everyone? As we know that the parts of axial and appendicular. Next concept, make heading radiation oncology. Radiation oncology.
Hi Mohan. Why there is a hash in front of these two? These
Sequence code.
What does it indicate? 8085 and 086.
77081. After that, what is the next code you need to get in terms of sequence numerical order? In terms
Two should come.
082. But what is the code we are getting here?
5.
085. That means this code is out of numerical sequence. You can see the symbols.
Got it.
You can see the symbols here. That is a resequenced code. Generally, you will go directly to the code description. You can see code is out of numerical sequence. C in between. 8888
Okay.
like that.
Okay. Thank you.
See, Johnsy. Johnsy. Nitin.
Hello, sir.
Yes, Nitin. Yeah. You are getting a question regarding DEXA scan, Nitin, in the exam. Immediately, what you need to recall in the question and what you make you underline. What are the key terms?
Sir, key terms. First, we have to understand the axial skeleton, appendicular skeleton,
Okay.
axial with vertical
Okay.
fractures.
Or vertebral.
Yes.
First, you need to put those key terms. Then you need to check for the body parts. If more than one body part also they examine only one time. One or more sides. Axial skeleton means what are the body parts? Head, neck, trunk. Yes, sir. Now, spine comes
Yes,
under
sir.
axial or appendicular?
Axial.
Axial. Hip, pelvis?
Appendicular.
Axial only. See, those are the part of trunk. From upper leg onwards, it is appendicular. You can see here they have given, that's why examples for you. 77080 example hip pelvis is given in 77080 or not?
Yes, sir. Yes. 77080 pelvis is there. Hips and pit.
That means they consider it as a part of trunk, the lower portion. Then if you see 77080 081, they took it as radius, wrist, heel. That is nothing but peripheral. 77081. Understood? When you are coding, be careful. See the code description properly and then you can code. Okay. Now my question is,
yes, sir.
Shravani, if physician is performing DEXA scan on axial skeletal of hip, pelvis and spine, 3 body parts, what is the code? Hip, pelvis and spine, what is the code? Shravani. Pawan, Pattabi Pawan. Yes, Shobha. DEXA scan is provided on hip, pelvis and spine. What is the code?
77080, sir.
Only one time or we need to code into 3 times?
Only one time, sir.
Why? Because in the code description, if you notice, one or more sites is there. If one
Yes,
body
sir.
part or more than one body part from my axial skeletal is examined with the help of DEXA scan, we need to report only one time. Is that clear, the concept, everyone?
Yes.
Okay. Next, make heading radiation oncology. Radiation oncology. Radiation oncology. Again, take the flow chart. Radiation oncology. In one or two papers, we can learn radiology chapter. Radiation oncology. Now, first key term, like this. First one, planning. Planning. First key term, planning. Second key term, simulation. 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 First key term, planning. Second key term, simulation. Third key term, delivery. Delivery. Fourth key term, management. Management. Fourth key term, management. Fifth key term, dosimetry. Dosimetry and device. Dosimetry and device. Dosimetry and device. Now, what are the 5 key terms that we need to look for in radiation oncology? First one is planning. Second one is simulation. Third one is delivery. Fourth one is management. Fifth one is, what is the fifth term?
Dosimetry and device.
Dosimetry and device. Next point, right on. Planning, simulation, simulation and delivery. Planning, simulation and delivery. Codes are based on number of treatment areas. 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 Next point. One area equals to simple. One area equals to simple, or single area equals to simple. Two different areas, intermediate. Two different areas, intermediate. Three different areas. Three different areas. Complex. Three different areas, complex. Three different areas, complex. Next point. Management code is based on total number of treatments. Management code is based on total number of treatments. Is based on total number of treatments. One cycle equals to maximum 7 treatments. One cycle equals to maximum 7 treatments. One cycle equals to maximum 7 treatments. Now, when we are getting a question radiation oncology, what are the key terms we need to look for? Radiation oncology, what are the key terms we need to look for?
Planning, simulation,
Planning,
delivery, management, simulation,
simulation.
delivery.
Okay. These are the
Simulation.
for example, you are getting a question regarding delivery. Next, what you need to look for in delivery? You are getting a question.
Single area. Single area, two different areas, three different areas.
That means the codes are based on simple, intermediate, or complex. Now you can see the codes. Can you see the code 77261? Can you see the code 77261? Are you there? 77261, page number 546.
Yes, sir.
The key term you can see in the question, the code planning is there.
Yes.
Then in planning you can see simple, intermediate, complex. Next 77280, can you see simulation is the key term?
Yes, sir.
Again simple, intermediate, complex. Next you can see delivery.
Yes, sir.
In delivery, can you see the codes 77402 407 412 402 407 412? Four zero two 407 412.
Yes, sir.
Okay, again, then you can see management, the key term 77427. 77427, management is the key term. 77427, management is the key term. 77427, radiation treatment management. As I said, based on number of treatments. How many treatments are there? 5 treatments. We can use the code up to maximum 7 treatments. Sir, now, when you are getting a question radiation oncology, what are the key terms we need to look for in the question? What are the key terms we need to look for in the question? It is planning or simulation or delivery or dosimetry or management. If it is planning, then you need to look for number of treatment areas. Now, up to here total how many concepts? 3 concepts we have written. When you are getting a mammogram question, what are the key terms we need to look for? It is screening mammogram, diagnostic mammogram, tomosynthesis. Next, what is the other one?
MRI.
Okay, you need to check for unilateral or bilateral. Then if it is DEXA scan, you need to look for it's an axial, appendicular or vertebral that we need to look for. If you are getting a question regarding radiation oncology, is it planning, simulation, delivery, dosimetry that you need to look for? If it is planning, again you need to look for number of treatment areas. These are the key terms. You understood, everyone? Now see question number 24. 24. Yeah, question number 24. What is the key term here? What is the key term?
Radiation treatment, single area.
You can see electron volts means it is delivery. Single area. What is the code for single area delivery?
77402.
77402. Understood everyone? The key terms? Next one, make heading diagnostic radiology. Everyone got the same answer? 77402. Any different answers?
Yes, sir.
Okay.
Sir,
Next one.
sir, in radiation oncology,
In radiation
in radiation oncology, where are the codes for dosimetry and device, sir?
dosimetry and device. You can see in order.
Yes, sir.
Before delivery, the codes are dosimetry and delivery. You can see. Page number 546. 546. Are you there? Intentional monomodulated radiotherapy. Type of dose. It's a direct one. Brachytherapy, teletherapy. Okay. Next one. Make heading diagnostic radiology. Diagnostic radiology. Write down the key terms. First point, body part or body area. What we need to look for in diagnostic radiology? First one, body part or body area. Second point, type of technique or procedure performed. 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 Next point. If X-ray or radiological examination is performed, if X-ray, or radiological examination is performed, codes are based on number of views. Codes are based on number of views. Number of views. You can see my screen. If I said anterior means one view, just write down like this. Anterior means one view. Second one. Posterior means one view. If the documented posterior means one view. Third point. Anterior-posterior. Anterior-posterior means one view. Anterior-posterior means one view. Next one. Posterior-anterior. Posterior-anterior means one view. Posterior anterior means one view. Posterior anterior means one view. Next, anterior and posterior. Anterior and posterior, two views. Anterior and posterior, two views. Next, anterior hyphen posterior. Hyphen means you just put like this. Anterior hyphen posterior, one view. See, when you are getting a question regarding X-ray or radiological examination, what is the key term you need to look for? When you are getting question regarding X-ray or radiological examination, what are the key terms we need to look for?
Number
Number
of
of
views.
views.
First, we need to look for body part. Then we need to look for number of views. For example, there are 4 body parts. On each body part, we need to look for number of views. If the question is the procedure performed is X-ray or radiological examination, we need to look for body part, then number of views. Anterior means how many views they performed.
One view.
One view.
Posterior means
One view.
anterior posterior means
One view.
One view.
anterior posterior means what? Front to back. Posterior anterior means
One view.
One view.
like that the views are. Okay, next one. Next technique. If physician performed CT means computed tomogram. If physician performed CT means computed tomogram, MRI means magnetic resonance imaging. And MRA magnetic resonance angiogram. Magnetic resonance angiogram. CT, MRI and MRA. CT, MRI and MRA. Codes are based on first point with contrast. Second point without contrast. Without contrast. Third point without followed by with contrast. Without followed by with contrast. Again you can look for, say if CT, MRI and MRA is performed, how the codes are based on? With contrast, without contrast, without followed by with contrast. Without followed by with contrast. Now next point item. Contrast means a dye, DYE dye. Contrast means a dye used to examine a body part. A dye used to examine a body part. Dye used to examine a Dye is used to examine a body part. Now, right. If the dye administered through mouth or rectum, mouth means oral. Dye administered through mouth or rectum, administered through mouth or rectum, code by default as without contrast. Code by default as without contrast. Code by default as without contrast. Next point. If the dye administered through needle, the dye administered through needle, code by default as with contrast. The dye administered through needle, code by default as with contrast. Code by default as with contrast. Code by default as with contrast. Now you can see here. First we need to look for body part. Then you need to look for type of technique performed. It may be X-ray, it may be CT, it may be MRI, it may be MRA. If X-ray is performed, we need to look for number of views. If CT, MRI, MRA is performed, what are the key terms we need to look for? The physician is performed with contrast, without contrast, or without followed by with contrast. What is the meaning of contrast? A dye examined. It's a contrast means what? A dye material used to examine a body part. How the dye is administered into the body through oral or rectum, we need to code by default as without contrast. If the administration of dye is through needle, then we can code it as with contrast. Understood everyone? Just check that points. Shobha, can you tell me? You are getting a question regarding radiation diagnostic radiology. For example, you are getting a question regarding X-ray. What are the points you need to look for? When you are getting a question, X-ray?
Body part and number of views.
Number of views. You are getting a question regarding CT.
With contrast or without contrast? Without contrast followed by with contrast.
That means first we need to look for body part. Then we need to look for with contrast or without contrast or without followed by with. If you are getting CT, MRI, MRE, the same points you need to look for, yes, sir?
Yes, sir.
Okay. Okay. You can see the quotes. Go with the page number 514, 514. See the code description 70100, 70100, 70100.
Yes, sir, we are there.
Radiological examination means what? X-ray. X-ray or radiological
X-ray.
examination, both are same. Then what is the body part they are
Yes, sir.
examining? Mandible. Try to recall the anatomy. Mandible means upper jaw or lower jaw?
Lower jaw.
Lower jaw.
Lower jaw.
How many views they are going to perform? Less than 4 views. Understood everyone like that? If when you are getting X-ray question, you need to look for views. If you see the code description 70450, what is the technique? CT. What is the body part? Head. Then you need to look for without contrast or with contrast, like that you need to look for. Okay. Now try to do one.
Yes, sir.
Question number 9. 9. 9. 8 and 9. 8 and 9. Try to text me the answers so that I can understand you are in a correct track or not. 8 and 9. See, if you see the first question, what is the body part?
Ankle.
Views performed? How many views performed?
2 views.
2 views. Ankle, 2 views. You can go for the code. One is anterior posterior view, another one is lateral view. Yes, yes. Any question? Anyone? Any doubt?
Lateral means we have to take one view only, sir.
Yes, yes, yes.
Okay.
Anterior, posterior, and lateral. Lateral means side. What is the answer? 8th question.
Answer A, sir.
73600. Everyone the same answer. Any doubts here? Any doubt in understanding the question? Any doubt? Okay. Question number 9. What are the body parts here? Tibia and fibula. How many X-ray views? 2 views. Tibia and fibula, 2 views. What is the code?
73590.
73590, which is in B option.
B.
Any doubt in giving the answer?
Sir, 8th question it is mentioned as lateral.
Lateral means one view. Anterior posterior is one view. Lateral is one view. Total how many views are there? 2 views are there.
Okay. Okay, if it is mentioned as anterior and posterior,
Then 2 views.
then
But here won't
Lateral means side, no? Right or left side. Lateral means. So here one leg is injured.
okay.
anterior and posterior.
So right or left we can code on.
Okay. Anterior and posterior if documented, then you can consider it as 2 views. That's here. In the question they documented as anterior posterior. Anterior posterior means what? One view only. I said already the people will confuse there itself. That's why I have given in the form of nouns. Anterior means one view. Posterior means one view. Anterior and posterior means you need to consider it as 2 views. Anterior posterior means one view. Posterior anterior means one view. Anterior hyphen posterior means how many views I said? 1 or 2?
One view.
Just consider it as 2 views. Please make it as correction. 2 views.
Hind means anterior and posterior means 2 views.
Yes, yes.
Anterior posterior means one view. అంటే anterior posterior వ్యూ లో పెట్టి ఎక్స్ట్రా తీస్తారనమాట. అప్పుడు మనం anterior posterior కి కోడ్ చేయాలి. అండ్ అన్నప్పుడు సపరేట్ చేస్తారు. anterior ఫస్ట్ చేసి తర్వాత posterior చేస్తారు.
Any doubts?
Sir, anterior hyphen posterior, 2 views.
Yes, yes, yes.
And posterior 2 views.
Any doubts in question number 8?
Anterior hyphen posterior, sir.
Yes.
2 views.
Yes.
Anterior hyphen posterior.
Yes, yes. Okay. Do one more question, the last question for the day.
Hello, sir.
Yes.
Hello.
Please. Yes, please.
Anterior hyphen posterior, 2 view or 1 view?
2 views. You can consider it as 2. Initially, I said it as
Okay.
you can consider it as 2.
Yes, sir. Oh.
Only one question you can do. We will close the session for today. Today 4 concepts. Any questions? Any questions in that? Okay. Question number 43 and 44. 43 and 44. Try to do. We will close the session. Or do 44. Do 43 at home. 44. Please complete 44. This question number 43. First point. What is the body part there? Sorry, 44. What is the body part? In question number 44.
Chest.
Chest.
Okay. On chest,
Chest.
technique performed. On chest, what is the technique performed?
First done without
Without
contrast,
contrast, followed by with contrast.
followed by with contrast, the injection form.
Technique. What is the technique here?
MRI.
MRI. Now,
Am I right?
then you need to look for with contrast, without followed by with. What they have performed here?
Without
Without
contrast.
followed by with.
Without followed by with. Now you can go and see the question. It will be easy for you to find out the answer if you know what are the points I need to look for in the code. What will be your answer?
B is the answer, sir.
B for Bombay. Everyone? Any other questions?
Yes, sir.
71552. Yes. Okay. Any questions in today's session? Any doubts? Those 4 concepts: mammogram, radiation oncology, bone or joint studies, and diagnostic radiology. Yes, sir. We completed 4 topics today. Tomorrow we will complete radiology for you. No questions?
Mohan, can you please tell about this question 43, just above 44.
43. Yes. What is the treatment here going on? Management of radiation treatment. What is the key term here? Management. Yes, sir. Total, how many treatments they have done? 2 on Monday, 2 on Tuesday, 2 on Wednesday, 1 on Thursday. Total how many? 7.
Mm.
Yes, sir. If you go with the code description 77427, how many treatments are there?
5.
5.
5 it is showing.
In rule, I am telling the rule, we can use that code up to maximum how many treatments?
5.
You can see what I say. We can use that code up to maximum how many treatments?
5.
7 treatments.
7 treatments. How many
7.
treatments? 7. That means only one
7.
time we need to report. 7742.
Okay.
Understood? For example, if it is 8, then into 2 times the code. One cycle equals to minimum 5, maximum 7 treatments. We can use that code up to 7 treatments. Understood?
Mohan, that code is showing only 5 treatments, no? 77427 description.
No paragraph. Then you came to know the rule. It can be used up to 7 treatments. That's why I have given a hint for you as a rule.
Okay.
The code description is 5 only, but we can use maximum up to 7 treatments. Okay.
Okay. Okay. Thank you.
Any other questions from your end? Anyone? No questions? Thank you, everyone.
Sir,
Yes, Susmita.
sir, if it is above 7 treatments,
Then
like 9 or 10,
into 2 times. 77427 into 2 times.
2 times.
One more cycle.
Okay, sir.
Okay, one more cycle. But maximum not possible, Susmita, the patient will die. Cancer, that means radiation treatments, practically they will give twice in a week. Understood? Or day after day.
Okay, sir.
Maximum twice in a week or thrice, not more than that for cancer patients.
Okay, sir.
Sir,
Yes, sure.
radiation treatment delivery is 77402 under the guidelines is do not report 77402 in conjunction with 77373. What is this?
What does it mean? Means you cannot quote those two codes together. 772 and 77373, we will not build those two codes together. Either one can be built. That's the meaning.
Okay.
Okay. Thank you.
Okay, thank you.
I'll see you tomorrow.